Good afternoon, everyone, and welcome to Objective Leaders portion of the show. And I am John Mauricio. This afternoon, I have one wonderful news for you guys. And my guest today can tell you all that. And he is no other than Dr. Anil Shah and our friend Betty Pollack as our guest also. Good afternoon, everyone. And Dr. Shah, why are we here? What are we going to be talking about?
Well, there's a new device that was just FDA approved called Face and Neck Tight.
Exciting.
Yeah, it's super exciting.
And newly approved by the FDA. That's very important. And what does it do?
So this is the first time that there is a non-invasive way of doing a facelift and having true results. And I think there have been other devices that have been out there, but they've all kind of had issues. And those issues were lack of effect. What they tried to do was basically try to heat up the face, heat up the neck through the skin. When they did this, if they were too hot, they would burn the skin. And if they weren't hot enough, patients wouldn't see a result. So it's a completely different approach. Rather than going from the top down, this device actually goes underneath the skin so you can actually heat it where you want the action to go. So this is patient Betty, and her main issue is the lower part of her face and her neck is fuller than ideal. I've marked out the area where the face and neck tight area is going to be treating her face and neck. This is a combination of local anesthesia, which numbs up the area. And once the face is fully numbed, the face and neck tight can be introduced underneath the skin. The device itself has a black tip probe, and the energy is directed between the tip, which is the black tip, and the white portion of this applicator. It goes right underneath the skin, and that's where you want it to be doing all of the work. Once it's under the skin, you can actually hear the crackling, which is the contraction of the skin and the fat. It actually takes about 6 months to see a final result, but early on she's already seen some encouraging sign of improvement along her face and neck jawline.
Wow. And Betty has been your patient today, just today, right?
No. So Betty had a procedure done. She's still kind of early. Betty, when was your procedure? About 4 weeks ago.
Oh, I thought you were just coming from the hospital today. Oh, I'm sorry. How does it feel with this procedure, Betty? Did you feel anything?
Aside from the injection of the liquid, there's really no pain. You just feel pressure when the liquid is being injected. The recovery time is really quick.
Yeah, that's amazing. The healing time and looking normal in a month, that's really amazing. And there is no side effect. That's another thing, no side effect. But how did you get involved with this, Dr. Shah?
So I've been sort of looking for a solution for. I have a lot of patients who are, would say, ethnic skin. So these are patients who are Hispanic, Asian, African Americans. And one of the problems is these patients would have minor issues in their neck, a little laxity, sometimes in this area called jowls, a little bit of fat in this area of the face. And these patients wanted to have invasive surgical procedures, and they weren't quite candidates for like a deeper lift. And I wanted a non-invasive approach for this. And I've looked over the last 4 to 5 years at a lot of devices. And the problem with a lot of these devices was I wasn't seeing results. And so I've heard about this device, I heard about how it works, and the mechanism how it works, and thought this was a completely different concept. And once I was able to see it, I knew that this was going to be a reasonable answer for these patients.
Well, Betty, of course, is very, very white in complexion. Are you seeing more of the ethnic people, like dark-skinned people, like from the Philippines, from Africa or China or anything?
And I have patients from all over. So about 50% of my patients or at least 50% of my patients are from, I guess we would say, are Asian, Hispanic, or African American. So I'm used to dealing with patients of, I guess, skin of color. And again, just because we're used to techniques that work with Caucasian patients, which is a big part of my practice as well, but it's still important to have other techniques that work for other patients. And so this is why this is a special, novel approach to this.
I forgot to mention that Dr. Shah, Dr. Anil Shah, was from the University of Chicago, a plastic surgeon from the University of, how great can you be from the University of Chicago? And mostly research people that I know are from the University of Chicago. But you are practicing the actual thing. How did you get started with this?
Again, this is dealing with colleagues throughout the field and colleagues throughout the area and talking about different devices that are out there. And once I guess I caught wind about this device, I was exposed to this device early on, and I knew it was going to be a big part of my practice.
Wow. Are you mostly doing this procedure 100% of the time, or just it's a mix?
I think you have to mix it, and this is kind of a tool you use with your other techniques. For example, today I did a facelift, which was a traditional facelift, but for this patient, for what she needed, she was a better candidate for a traditional facelift and what she wanted. However, the patient before, actually I did this procedure in addition to just doing neck liposuction on her. She had this procedure done as well because she was older. And because she was older and Hispanic, we didn't want to do with a traditional facelift. We wanted to remove the fat from here and contract the skin. And so, again, for surgeons out there, I think this is another tool they can use in their armamentarium to help patients with more minimally invasive techniques when applicable.
I have the machine, and this is part of the machine, and this is the probe that poked to your face, right? Can you explain to our viewers how this thing works?
Yeah. So this is the handpiece, and we have just the handpiece. We don't have the machine with us today. And the way this works is this is where all the action goes on. And this probe will actually go underneath the skin. And with the probe underneath the skin, the temperature is controlled. It goes only between the probe and this device over here, this resistor. And so with the probe going underneath the skin, you can control where the temperature's at, what degree you want the temperature at, so it's a completely controlled thermal regulated field.
Wow, it's really amazing. And this is connected, of course, with to another monitor control panel, or what?
Correct. And on that monitor panel, that's where the temperature is regulated. And the temperature is regulated 1,000 times per second. So it keeps your temperature where you want it to be, so it's hot enough so that fat can coagulate, skin can contract. You can do something called the neocollagenesis, which creates new collagen to contract the skin. But it also keeps temperature safe, so it doesn't go too hot to prevent scarring and thermal injury.
Yes, and since you mentioned ethnic, with the dark-skinned people and a lot of pigmentation, why are the numbers increasing? Seeing you guys.
I think that everyone's aware of aging, and I think that it's not just one percentage of population who says, I want to look younger. It's a pretty universal thing that we all want to look our best and look our youngest. And if there's a non-invasive way of addressing this, I think it's a great, a great technique to think about for patients.
And of course, there are some other procedures that you use, right? Besides this one?
Yeah. Again, this is one tool in a collection of things that are available. And for some patients, a traditional facelift is going to be the best approach. But for patients who don't want surgery and they want to see a result, I think this is a great tool. For patients who are too young for a facelift, it's a great tool. For patients who have a history of poor scarring or risk of scarring, it's a great tool. And patients can actually feel the result. They can actually hear the result. You're actually going to hear fat. It almost sounds like bacon sizzling, which is, and which sounds bizarre. But how was that when you heard that?
It was quite different, but you almost heard the results, which I thought was.
Well, how many people have you helped so far with this procedure?
I'm getting close to 25 to 30 patients so far. And so it's, again, relatively new technique, but again, around 25 to 30 patients so far.
And the cost is?
So it really depends. Again, if it's being used with another procedure or by itself, if a patient comes in and wants to do just the neck area, that can be a little north of $2,000. If it's involving the face and the neck, that can be anywhere from $3,000 to $4,000, and around that price.
Anything else that you could say to our viewers?
Absolutely. I struggled with faith.
Oh, you're
For a
pretty.
while.
Come on.
But no, it was really a huge area of concern. And I think that with your body, if you feel uncomfortable with any part of your body, you can cover it up. Your face, not so much. It's the first thing people see. And for me,
Makes sense.
It was a huge, huge source of self-consciousness. I can honestly say that I didn't really expect to recover so quickly. I only took one day off of work. I was back to school and work the following day after taking one day off. There was a little bit of swelling, but really nothing extremely noticeable, nothing extremely outrageous, and I really do see results. I see it on photographs. I think that's really where I see it the most, where I feel that I'm beginning to look like myself from 10
$1
years
million
ago.
Betty, right?
Yes, and it keeps shrinking. I see results every single week. It looks better and better. The neck is looking better, my cheeks. It's just an amazing procedure, in my eyes at least, with my experience.
Wow. How did you connect with Dr. Shah?
Well, it's just, I believe I saw Dr. Shah, I came in for a consultation, and that was prior to this technique being available. And
Really?
Yes. And, despite the fact that, I'm in my early 30s, I had a lot of big jowls. It was there. There was nothing you could do about it. And the moment that this technology became available, I received a phone call from one of the staff who said, listen, I think this would work for you. Why don't you think about it? And
Would you recommend it to other people who have the same problem?
absolutely. Because I do see myself looking younger. I really do.
And you look great, but
I feel great.
that's the most important thing. If you feel great, it's worth the money.
Absolutely. And I think the interesting thing too is that, before I saw Betty, she had tried another procedure, a non-invasive procedure.
I did.
And that was ineffective. Can you tell me about it? So what did you try?
I tried coal sculpting. Which is a procedure also non-invasive, and it's supposed to freeze the fat cells.
Yeah.
And it was not a cheap procedure by any means, and unfortunately there were no results.
Well, again, Dr. Shah, thank you very much for sharing this knowledge and procedure, new things coming up, and we really thank you, and I hope you guys watching the show can call. Where can they call you?
So my office number is 312-944-0117.
All right. Again, thank you very much for sharing
so
your
much.
Sunday with us.
Thank you.
Betty, thank you. You're looking good. So again, this is Joe Mauricio. Thank you for sharing your Sunday with us, and mabuhay.